Hi, I'm David Brannon, disability lawyer. In this video, I'm going to talk about what medical conditions qualify for CPP disability. So after watching this video, you'll have a better understanding for your own situation on whether your medical condition could qualify for CPP disability and the factors that kind of go into that decision. So make sure as you're watching the video, if you like it, please hit that like button. Also leave your comments if you want clarifications or have comments for other people who will view the video. And also don't forget to hit the bell notification so you'll get notice every week when we post our videos. So certainly one of the most common questions we get is what medical conditions qualify for CPP disability? And more importantly, people want to know, does my medical condition, will that qualify me for CPP disability? So I'm going to answer this for you. The first thing to keep in mind whenever you think about whether or not you can qualify for CPP disability is the actual eligibility requirement. Now, if you remember, if you've watched some of our other videos, there are 3 requirements for eligibility. You have to be a certain age, 18 to 65, you had to have made contributions to the program, and you have to have a severe and prolonged disability as defined by the Act. Now, a severe disability is one where you have a mental or a physical disability that makes it impossible for you to regularly participate or hold down any type of regular, substantially gainful employment. You'll notice in that definition there's no mention of a medical condition. And it's important to understand that CPP disability does not have a list of medical conditions where it's, if you have this, yes, you get it. If you have this medical condition, no, you don't. There's no official list of medical conditions. In fact, if you look back at that definition, what they're focused on is the level of disability and how much it impairs your ability to work. So the actual answer is that any medical condition can potentially qualify one for CPP disability. It all boils down to how serious your symptoms are for that medical condition. So for example, many people will agree that a diagnosis of the medical condition of multiple sclerosis is considered a serious medical condition. So a lot of people who have recently got a diagnosis of multiple sclerosis, who've had an attack and who have since recovered from it, but still have multiple sclerosis and they are at risk to have more attacks that will affect their nervous system and motor ability and vision and everything else. They will often think because they have the diagnosis of multiple sclerosis, because it's a serious condition, that it should qualify them for CPP disability. But again, every situation is looked at individually. It's not the diagnosis. What they'll assess is at this given time, are your symptoms of multiple sclerosis, are they severe enough to the point where you are permanently incapable of doing or any gainful employment on a regular basis? So again, it boils down to what are your permanent symptoms and impairments that are associated with your multiple sclerosis. Now, that being all said, I don't want you to take away from this that your diagnosis doesn't matter or the medical condition doesn't matter, because that's not true. In fact, Service Canada requires all of its medical adjudicators to use something called the CPP Medical Adjudication Framework. That is the framework that they've kind of standardized, that medical adjudicators, they're the people who decide if your claim is approved or if it's denied. They have to follow this framework when making decisions, and they use this framework to try to standardize the process on how that these medical adjudicators go about making decisions. Now, one of the key parts of that framework is what is the person's medical diagnosis. So again, it is important to have a medical diagnosis and a medical condition, and I'll tell you why. Like, one of the things they look at during this framework is the impairment or disability that the person's claiming, is it logically connected to the medical condition that they have? So again, this is a way for them to see whether what you're talking about and the disability you're claiming, does it all make sense? So if you're claiming symptoms that don't match with a medical condition, then that's going to be a problem. So they will want to see whether the symptoms and the problems that you're describing are known to match with this medical condition. The other thing that's most people don't get right away is they also want to know whether you're getting the appropriate treatment. So the importance of your medical condition is very important because it dictates the treatment. So Service Canada will often accept that right now you have a serious disability, but they'll deny your claim for not being prolonged. They'll say it's not prolonged because if you were getting the right treatment, you would be better right now. So why they focus on what your medical condition is, they want to be able to say what type of treatment you should be getting. With each medical condition, there are accepted best practices out there on the type of treatments that should be tried to help people recover from this medical condition. You have to hope that your doctor is following best practices and that you're agreeing to try those best practices, or you're going to get yourself in a lot of trouble and your claim will most certainly be denied. So there you have it. Now you know what medical conditions will qualify for CPP disability. The answer is any medical condition can potentially qualify. What's most important is the impact of that medical condition on you. What are your symptoms? What are your impairments? What is the disability arising from the medical condition? It has to be serious and prolonged. You also know that Service Canada uses a medical adjudication framework to make decisions, and one of the big things in that framework is your medical condition. Now, if you like this video, please go ahead and hit that like button. Also, don't forget to subscribe so that you'll get our videos. And finally, hit the little notification bell button. That way you'll get notifications whenever we post new videos, usually once or twice a week.